Hi, my name's Aidan. I'm a student paramedic. What's your name?
Hi, I'm Paul.
And how old are you, Paul?
I'm 50.
50. And when was your date of birth?
22nd of April.
I'd just like to do a quick respiratory assessment. Is that okay with you?
Sure, yeah.
So, have you ever smoked?
No, I have not.
Do you have any current respiratory illness?
No.
Any past respiratory illness?
Oh, I had a bit of asthma.
Okay. And did you take any medication for that?
Bedtime, but I'm okay now.
Okay. And do you have any shortness of breath?
No, I don't.
Well, ever had it?
Oh, only when I had the asthma.
Okay. Now you're comfortable as you are?
Yeah.
Okay. Do you have any other respiratory illness such as emphysema, cystic fibrosis, stuff like that?
No.
And do you work in a dusty environment?
No, I don't. I work in an office.
Okay, you work in an office. Have you been on any recent long flights or international flights?
No, I haven't. Just
No.
to Australia.
Just Australia, okay. And what about any deep vein thrombosis?
No, I never had any of those.
What about any recent surgeries?
No, no surgery in the last 10 years.
Okay. What about cancer?
No, I don't have any.
Okay. And do you have any pet chickens or pigeons or anything like that?
No, I don't.
Okay, so I'm just trying to reduce some risk factors for respiratory illnesses and PE. Just going to quickly take the pulse, if that's alright with you.
Sure.
Count to 15. Get his push rate. So wrist rate of 16. Doesn't seem to be any nasal flaring or any issues with breathing. Could you count to 10 for me?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay, so obviously no issues with doing full sentences. Can I just look at your eyes quickly? So if you just pull down your eyelids. So I'm just noting the conjunctival pallor, so it's not anemic. I'll just quickly look in your mouth. Open up. Let's go ah. So there's no swelling of the what are they called? Tonsils. That's right. And there's no other redness or swelling that I can see. Doesn't seem to be signs of central cyanosis. So just get you to lean back at a 45-degree angle for me. Thanks. I'm just going to assess the jugular venous dissension, which would be a sign of pulmonary hypertension or edema. Also right ventricular failure, so I don't see any of that. So if you just quickly check your hands, just take a radial pulse. A strong regular radial pulse, warm temperature of the hand, good capillary refill, good temperature. Doesn't seem to be any cigarette tarring on the fingers, so he's obviously not a smoker, which we've asked him already. And then I'll just feel you clear. So it's definitely centred in the midline, and there doesn't seem to be any tugging, which would suggest a airway obstruction. I'd just like to listen to your lungs there. I'll just get you to take a deep breath in through your mouth. And again. Okay, and could you just lean forward for me? And again, just taking a deep breath. Again. So I'm not hearing any wheezes or crackling, which would suggest fluid in the lungs. Just kind of take a quick look at your chest. So there's no accessory muscle use, so he's obviously not in any respiratory distress. The equal air entry into all lungs and lobes of the lungs. There wasn't any sound, so it was clear. And now I'll just feel your chest just a bit there. I'm also not feeling any deformities or any crepitus or anything like that. Nice. Again, check the chest expansion. Yep. I'm just going to palpate. It's just me tapping gently on you, okay?
Okay.
So I'm just going to listen for dull or resonant sounds which could indicate fluid or tension in the thorax. So, not hearing any. Just lift up your arm, just on the side here. And on this side. And I'll just check your skin just to make sure that you're not sweaty or too dry. And so I'm happy with that respiratory assessment. I'll just get you to one last thing, is just to lean forward and just repeat the word 99.
99, 99, 99, 99, 99.
Okay, so there's a little bit of vibration which could it's used for lung consolidation, but it's very minor. I'm not too worried about that, so I think I'm happy with that. So patient is a well working respiratory system with a very low abnormality, I'd say very low acuity. This patient's fine.